Hi, I'm Walter Williams, and I'm an attorney with Steptoe & Johnson. I'm on our healthcare practice team and work with hospitals and other healthcare providers addressing healthcare law issues. Today, I'm going to talk about the Stark Self-Referral Law. It's a federal statute, and it's a strict liability statute with significant penalties for non-compliance, and those penalties can also result in false claims. The basic prohibition of the Stark Law is that it prohibits a physician from referring designated health services payable by Medicare to an entity with which the physician or an immediate family member has a financial relationship, unless the financial relationship meets one of the enumerated and outlined exceptions under the law and the regulations. In addition, the entity receiving the referral is prohibited from billing for the referral and has refund obligations as well as reporting obligations. There are several key terms that I mentioned that are very broad. For example, the referral must involve designated health services, at least on the face of the regulations, payable by Medicare. Designated health services include such things, among others, as clinical laboratory services, home health services, radiology and imaging services, inpatient and outpatient hospital services, as I said, among others. Moreover, the federal government has undertaken enforcement actions to extend the reach of the Stark Law to Medicaid referrals as well. I mentioned some other terms that are broadly defined. For example, the referral must come from a physician. However, a physician may be more than just a medical doctor or an osteopathic physician. It can include dentists, podiatrists, and chiropractors. Moreover, the triggering event is a financial relationship. So you have to look and see what a financial relationship is. Financial relationships can include ownership, interest, investment interest, or compensation arrangements, and something as simple as free parking or a free meal could be considered compensation or remuneration, which creates a compensation arrangement under Stark. Financial relationships can be both direct and indirect, so you can have any number of intervening entities between a referring physician and the recipient of a designated health service referral and still have a potential Stark relationship that would have to meet an exception. As I noted, the exceptions exist for various financial relationships, and you need to meet those in order to get around the referral prohibition and the billing prohibitions. These exceptions are quite broad and very detailed, and you need to make sure that you meet all the terms of an exception in order to be in compliance with the Stark. Additionally, the government has taken the position that you can't turn back the clock on non-compliant arrangements, which means your exception has to be met before the referral is made. Given the huge penalties that may attach for violations of Stark, it's critical that your enforcement and compliance efforts include robust efforts to make sure that any financial relationships meet the terms of an exception for Stark, where Stark referrals are at issue. Again, I'm Walter Williams, and our healthcare practitioners assist clients in dealing with Stark and a host of other healthcare issues.